Good evening, folks. Thank you very much for tuning to our channel today. People ask me, how did you become a licensed physician in the United States? What is the secret? How did you pass your USMLE exams? The secret is you should not study everything. You study only high yield material. Okay, high yield material, and also don't spend too much money. Okay, some of these courses I see Kaplan is selling some courses for $5,000 or $10,000. That's insane. You don't have to spend too much money. Just to spend $10. Okay, just to spend $10 on the question bank I prepared for USMLE. So go to our website supertestscores.com and get this question bank. I prepared 1,000 questions with notes with the high yield material you must remember to crush USMLE. So go to Super Test Scores and buy this course for just $10 and crush USMLE, and your dream of becoming a licensed physician in the United States is right before you. So today I would like to talk about Giardiasis. Giardiasis is a very important disease to know about because it's the most common protozoal infection here in the United States, and it is also globally prevalent. So people usually come to you complaining of like foul smelling, greasy stools, also sulfuric belching, like they belch these sulfuric gases from top and bottom. So it's a very annoying disease. It can come as an acute diarrhea, and it can also become a chronic diarrhea and malabsorption. Usually, when you see a question, the description will be like this: so and so went for camping or hiking, or they went and they drank from a pool, they went and drank some water from a stream in the mountains. So water contamination is the main transmission for this infection. It can also happen through oral fecal route. Okay, so sometimes in daycare center it can come from the fecal oral route. In homosexuals it can happen from oral fecal route, oral anal route. Okay, so there are many ways you can get this infection, but the most important thing is water contamination. If you look at the organism, Giardiasis is caused by Giardia lamblia. It's also known as Giardia duodenalis. It occurs in two forms, cysts and trophozoites. So trophozoites has like flagella, and it also has nuclei. Cysts also have nuclei, and the cysts are the infectious form. So you are exposed, you are drinking water contaminated with the cysts. Those cysts go into your stomach and the duodenum, then the excision occurs, and the cysts become trophozoites and they attach to the intestinal epithelium. They do not invade. Okay, that's an important point. They are just attaching. The trophozoites, using their ventral sucking disc, they attach to the intestinal epithelium and they block fat absorption. That's why these patients have fat malabsorption, because these trophozoites are obstructing fat absorption. And all that fat goes out as greasy stools. That's why, because there is no invasion, there is no blood in their stools. Okay, so they are having non-bloody stools. And these trophozoites and cysts will contaminate the next person through that fecal transmission. So patients will have foul smelling, greasy stools, floating stools with sulfuric belching, abdominal pain, and chronic diarrhea, they can develop vitamin deficiency and other deficiencies, malabsorption syndrome. How do you treat this? There are a few drugs, but the first line is metronidazole. Metronidazole is the first line. You can also use tinidazole. Tinidazole is another medication. For children, pediatricians prefer furazolidone because it is available in the liquid form. In pregnant women, paramycin is a good medication because it is safe to use, but it is not as effective as metronidazole. So the metronidazole and tinidazole, they are the most effective medications to treat giardiasis. So if you want a treatment, you are welcome to come to my office, call our phone number, and we would love to help you to get the right treatment for giardiasis. All right, folks, that's about giardiasis. I hope this video helped you. Please leave your comments if you have anything to add to this topic so others can read it and get benefited from this forum. Thank you. God bless you.